I'm going to do a head-to-toe assessment on my patient today. So the first thing I'm going to do is perform hand hygiene and wash my hands before I come in. When I'm coming into the room, I'm going to put on clean gloves, and I'm going to introduce myself to the patient and explain what I'm going to do. Hello there, I'm Lindsay. I'm going to be your nurse today. Can you tell me what your full name and date of birth is?
I'm Henry Graber.
What's your date of birth?
December 15th, 1957.
Okay. I'm going to check your armband for your name. Can you tell me where you're at today?
I'm at the hospital.
Why are you here?
I think I have pneumonia.
Yeah. Do you know what time of day it is around?
Probably around 2.
Yep. Okay. I'm going to start my assessment. I'm going to do a head-to-toe assessment on you. So the first thing I'm going to do is listen to his lungs, and I'm going to go under his gown. Okay, take a deep breath for me. Again. 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 Okay, one more time. Now I'm going to listen to your heart. Nice and strong. Now to help turn my patient, I'm going to get one of my nurse friends to help me. While I'm doing this, I'm also assessing my patient's skin. So while they're on their side, I'm also going to assess their skin and their bottom.
Okay.
So, my patient. Thank you. I'm gonna note that he has a pressure wound on his bottom here. It's a pretty nasty pressure wound. How long have you had that pressure wound? How long has your bottom been like that?
About 3 months now.
Oh, really?
Yep.
Where do you live?
In the nursing home.
Okay, I'm gonna listen to your lungs back here. Take a deep breath for me. Again. Again. One more. Okay. Gonna roll you back over. Then before my friend leaves, I'm gonna have my patient sit up so I can listen to him like that, because if they're laid on their side, they may not be able to breathe fully. Take a good deep breath if they're on their side. Okay, I'm gonna listen to your lungs one more time. All right, take a deep breath for me. Again. Again. One more time. Okay, you can go ahead and lay back down. Okay, now I'm gonna continue my assessment. I'm gonna pull back these. I assessed the skin on his arms and his face, looked at his hands, assessed the turgor and the condition, all that kind of stuff. I'm gonna look at his stomach, assess the stomach, and when I've got this part open, I'm gonna listen to his bowel sounds in all 4 quadrants. I'm gonna note and document all of my findings, all of my skin findings, and that his bowel sounds were present in all 4 quadrants. So I'm gonna keep assessing my patient and his skin. I'll assess kind of some mobility while he's laying like this. I'm gonna Look for edema in his legs at all. Note that there's another wound right here. What's that wound from?
I'm not really sure, honestly.
Okay, well, we'll take a look at it. So I'm gonna assess these for any tinting or something like that, any impressions. Check the feet for swelling. What happened to your ankle or your foot?
I fell down.
You did?
Yep.
Well, we'll have that looked at while you're here too. So I'm going to assess pedal pulses while I'm down here. I can't assess a pedal pulse on this because it's wrapped. I talked to the doctor and it's okay for me to take this off, so I'm gonna take it off. Oh, you have a nasty wound on that foot. Just kidding, the doctor said to put it back on. Okay, so I'm gonna put this dressing back over this wound. I assessed this foot and there is a pedal pulse here, so I know there's there's good blood flow to his legs. I'm going to assess a radial pulse. Note and document that they are both there. And now I'm going to do my vital signs. So my patient has pneumonia, so a couple important vital signs that I'm going to assess is going to be respirations and their O2 stat. He is on oxygen. He's on 2 liters, and that is to keep his stats above 92, so that we know he's getting good oxygen. So I'm going to start with blood pressure.
Oh my God.
I got 138/90 for my blood pressure. What does your blood pressure usually run? Is it pretty high or is it usually around normal?
That's usually actually pretty normal for me.
Okay. Are you on any blood pressure medicine?
I might be. I'm not really sure.
Okay, well, we'll take a look at it. I'm going to take your pulse now. I got 85 for your pulse. Now I'm going to count. I'm going to count my patient's respiration rate, but I'm not going to tell him that I'm going to count it because it could mess up his breathing. 23 for my patient's respiration rate. So in my vital signs, I'll also assess my client's temperature and his pulse ox and his pain. Are you in any pain today?
No.
Okay, good. Now that I am done, I'm going to cover my patient back up. I'm going to, when I came in, the patient's bed was raised at a good working height. So I'm going to lower his bed and put him back in a comfortable position. Make sure the side rails are up and put his call light in reach, and then I'm going to take my gloves off and perform hand hygiene.